II receptor blockers or angiotensin receptor blockers. Angiotensin II receptor blockers bind to angiotensin II receptors on the vascular smooth muscles and the adrenal glands, preventing angiotensin II from binding and decreasing aldosterone release by the adrenals. These actions reduce vasoconstriction and increase sodium excretion with water, lowering blood pressure. Angiotensin II receptor blockers are used to treat hypertension and heart failure secondary to ACE inhibitors. How do we identify angiotensin II receptor blockers? They end in sartan, losartan, valsartan, candesartan, olmesartan, telmisartan, irbesartan. Angiotensin II receptor blockers are administered orally. The side effects of angiotensin II receptor blockers are the same as ACE inhibitors, except for a lower risk of cough and angioedema. Hypotension, hypoglycemia, hyperkalemia, dizziness or lightheadedness. First dose effect. Let's discuss the first dose effect. The first dose effect usually occurs with the first dose. The client will experience palpitations, lightheadedness, syncope, and a significant drop in blood pressure. The nurse must stay with the client and monitor closely to effectively manage adverse effects or reactions. Angiotensin receptor blockers are contraindicated in pregnant and breastfeeding clients. Now, let's move on to nursing considerations and client education. Monitor blood pressure routinely, especially if the client is on a diuretic or other cardiac medications. When giving angiotensin receptor blockers for heart failure, monitor weight and routinely assess the client for fluid overload resolution. Also, assess for peripheral edema, rales/crackles, dyspnea, weight gain, and jugular venous distension. Monitor the potassium level and look for signs and symptoms of hyperkalemia. Place the client on the cardiac monitor because potassium affects muscles, including the heart. Finally, client education. Educate the client to change position slowly to avoid orthostatic hypotension. Educate clients to avoid potassium supplements, NSAIDs, and salt substitutes. Salt substitutes contain potassium. Educate clients on high potassium foods such as avocados, bananas, oranges, pork, potatoes, spinach, and tomatoes. Do not skip doses or stop abruptly taking angiotensin II receptor blocks, which will lead to rebound hypertension. Lifestyle modifications include a low-sodium diet, exercise, and quitting smoking because taking the antihypertensive medication does not cure hypertension. Daily blood pressure self-monitoring and keeping a log to bring to their doctor's appointment. Lastly, the client should be educated on angioedema. It is rare to occur with an angiotensin receptor blocker compared to an ACE inhibitor, facial, lips, mouth swelling, and difficulty breathing. That is all the notes on angiotensin receptor blockers. See you next time.